Welcome back. In your morning medical news, dealing with grief around the holidays where friends and family get together for the few times a year can be stressful and hard. According to Mayo Clinic Health System, although everyone deals with grief differently, some common symptoms include getting tired more easily, having trouble eating or sleeping, or being more sensitive to those around you. One physician tells News 8 that those grieving a loss should begin with the small things and then seek out help.
It's really important to do the small things. Focusing on getting out of bed, getting dressed, maybe eating breakfast is a very good place to start. But once someone can reach those milestones, then it's important to reach out to someone who's near to them, or perhaps even a neighbor.
Mayo Clinic Health System also recommends that anyone who has lost someone to eat healthier and also make sure you catch up on enough sleep. If symptoms of grief continue, you should also talk to your doctor. A federal rule change will allow for easier access to kidney and liver transplants for people with HIV. Health and Human Services officials say people with HIV who need those transplants can now receive organs from donors who also have the virus without having to be part of a research study. The Biden administration says the rule change should reduce wait times and expand access to organ transplants. With this rule change now in effect, kidney and liver transplants involving donors and recipients with HIV are no longer required to be part of clinical research. Hospitals that stopped universal testing and mask wearing saw significant increases in viral infections. A study of 10 hospitals in the Mass General Brigham Hospital system saw a 25% rise in infections after masking and universal tests ended. When mask rules went back in effect, viral infections once again dropped to normal levels. Kids who grew up with pets or farms have fewer allergies. A study by the journal PLOS looked at children who were exposed to animals at a young age and found they had lower rates of asthma, food allergies, and eczema. The reasons for the difference aren't fully understood, but could be linked to microorganisms in the gut. Well, from turkey to mashed potatoes, stuffing, and pies, many of us ended this Thanksgiving day with full stomachs and refrigerators. But how long do Thanksgiving leftovers really last? Well, good question. Kirsten Mitchell took that question to a food safety expert.
Oh my God, this is wonderful.
It's a meal that keeps on giving.
I eat anything from stuffing, turkey, ham.
How many days will you keep leftovers in your fridge for?
I'll keep it, I mean, it really depends what it is, but maybe a week or something like that.
In between 3 to 5, depends on what it is for me.
For the official guidance, we turn to Mandy Sedlak, a global food safety and public health director at Ecolab.
The USDA recommends anywhere between 3 and 4 days based on how you handled all of the food when you prepared it. Were you washing your hands while you were preparing it? Wiping down surfaces, preventing cross-contamination.
After the food is prepared, the USDA says you shouldn't let it sit out for more than 2 hours. 1 hour if it's in an environment above 90 degrees, like a hot car.
I'm the kind of person who, if the pizza's out overnight, I will still eat it in the morning, so.
Multiple hours.
Multiple hours, yeah.
Bacteria can grow at temperatures between 40 and 140 typically. We call that the danger zone. Yes, look at you, well done.
Avoid the danger zone by promptly putting foods in the fridge or freezer.
What kind of temperature should the foods be going into the fridge at?
That's a great question. You can put them in as quickly as you want to, but you want to encourage that cool down quicker. Put it in the fridge in smaller containers, loosely put the lid on, and make sure that your refrigerator's not overloaded.
If frozen, the USDA says leftovers will remain at best quality for up to 6 months, depending on how they're stored. They should always, though, be reheated to 165 degrees and only reheated once to avoid foodborne illnesses.
Once you have cooked something, then you cool it down, you freeze it, you reheat it. You've gone through that temperature danger zone quite a few times.
Sedlak says typically bacteria doesn't change the taste, smell, or appearance of the food. If that's changed, it's a clear sign to toss.
I'm a goofy person, so I'll taste it first, and then
A taste test?
yeah, I taste it. I'm like, do that, and then I'm like, nah, this ain't it.
If it's still in there, it's still good, you give it the sniff test, and then, you're taking a gamble, but I've never gone wrong with it.
If there is an odor, if there was mold, if there was something of that nature, that would definitely be a sign to not eat it.
I think you'll probably not want to eat it.
Right. Your appetite might be turned.